All right, so for our next segment, we're really excited to showcase AI Innovation Showcase. And you've already heard everyone in the morning, how health systems, hospitals are rolling out AI pilots, what solutions they're using them for. We heard a bit from academia industry as well about foundational models, for those building what's coming next, where are foundational models strong, and where are they still falling short. And so this year, AIMI is really excited to do an AI Innovation Showcase, where beyond talking about pilots that are already rolled out, what's coming next in terms of startups, innovation, innovative solutions that are being built. And so we received over hundreds of applications, and unfortunately, we couldn't accommodate all of them. And these are the three really exciting guest speakers we have, starting with Dr. Bryce. So Dr. Bryce studied engineering in France before completing an MD PhD degree from Harvard MIT. He is now an associate professor at Stanford, a board-certified anesthesiologist, and a co-founder of precision medicine tech bio company called SurgeCare. His research employs omics technologies and sparse machine learning to develop AI-based immune digital twin models for predicting and preventing adverse clinical events ranging from surgical infections to adverse pregnancy outcomes. I'm Dr. Bryce.
Thank you. Hi, everybody. Well, thank you, Ethan. Super exciting conference, and I'm really looking forward to continue any conversation afterwards this afternoon. It's really great time and an honor to be here. So most of my time, I run a systems immunology lab here at Stanford. I'm also an anesthesiologist and a co-founder of this company called SurgeCare. And we believe, and I hope other people believe it as well, that immunology is finally ready for a deep learning moment to transform precision medicine. What we're aiming to do at SurgeCare is to build maybe the first foundation model that can really translate complex multi-omics data sets, immunological data sets, into clinically reliable biomarkers that can be transformed into precision medicine tools. Why focus on the immune system? Immunology is at the intersection of all disease processes. And with the advent of omics technologies, we can now measure the human immune system with unprecedented resolution. With single-cell proteomics techniques, we can measure millions of data points in individual patient samples. But the translation of these multi-omics data set into clinically actionable tools, that has remained a bottleneck. The problem is that, yes, in the last decades, there's an exponential capacity to measure thousands, millions of data points in individual patient samples. But on the flip side, the number of samples, the number of patients that are included in these omics studies, they remain the same. So 90% of omics studies have less than 100 patients involved. So statisticians don't love that. And basically, it makes the data really noisy. And it's very difficult to identify these clinically reliable, these statistically reliable biomarkers among the haystack of multi-omics data sets. How do you find the needle in the haystack? And so at Surge, at the core of the technology is a new machine learning framework that we've developed and made the cover of Nature Biotechnology recently, where we use a noise injection technique to derive a data-driven signal-to-noise ratio that really allows identifying the most reliable, stable biomarkers among the host of a multi-omics data set and transform these biomarkers into clinically applicable tools. So we follow this three-step process. We're assembling and generating a large data set that is really focused on multi-omics analysis of the human immune system, focusing on techniques that we're very familiar with. There's always a single-cell proteomic platform included in these omics data set called mass cytometry. Then we integrate this with curated clinical outcomes. Then the second step is to build a foundation model that's trained across the different omics data layers to generate a feature set that can really give a meaningful and biologically interpretable representation of patient's immune state. And then the third step is to apply this machine learning framework called biomics to identify the needle in the haystack, to identify these relevant clinical biomarkers, and then build a multivariate model that predicts specific outcomes. So in the last couple of years since we started the company, we've made significant progress. We've partnered with dozens of academic centers and pharma to generate a multi-omic data repository that contains over 1,000 patient samples that represent more than 2 billion single-cell data sets. And we've already gone from A to Z in a specific clinical application. We have a first product called Presight in the context of surgery for the prediction of surgical site infection. We know a little bit about surgery, being an anesthesiologist. Surgical site infection is one of the most devastating complications after surgery. And so using or applying this platform in 3 independent studies of over 1,000 samples, we've been able to identify, build, and validate a multivariable model that predicts these infections with an accuracy of 94%. That's way above the gold standard. And this model is based on the measurements of only 6 biomarkers. So now we're developing a CLIA-certified diagnostic test in partnership with UPenn and their immune health initiative, and then 2 hospitals in France to really put this information in the hands of physicians and surgeons to transform perioperative care. So in the next couple years, really the goal is to continue partnering with pharma, partnering with academic centers to increase this data repository. We hope to reach 100,000 samples in the next 3 years, and then continue identifying biomarker panels in specific clinical verticals. So we're continuing on the surgical space with really predicting any complications after surgery. There's a focus on cognitive decline after surgery, but also pain recovery and functional recovery. We have a large project in the context of women's health that's a focus of my lab for the prediction of preterm birth preeclampsia, and then a 3rd vertical in recovery after stroke. And so I'll take questions later, but really thank you for your attention.
All right, next up, we have Dr. Xian Zhao. So Dr. Xian Zhao is an expert in the psychology of social connection, well-being, and human-AI interaction, a very hot topic, as all of you know right now. She's a CEO of Flourish Science and a research scientist at Stanford University, and she's got deep experience designing science-based products to support emotional, social, and mental well-being. Xian earned her PhD in psychology from Brown University and completed her postdoc at University of Chicago Booth School of Business. Her research has been published in top academic journals and featured in outlets such as the New York Times, Harvard Business Review, BBC, and NPR Science. Please take it away.
Thank you. Hi, everyone. I'm Xiaohan. Very nice to be here. I'm a social psychologist and a behavioral scientist by training. So today I want to share the work, the product, the research, and also the partnerships we are growing at Flourish. Flourish is a leading AI-powered mental health promotion, prevention, early intervention solution. So the reason is because our society is in a big mental health crisis. I'm sure you've all heard about it. The kids are struggling, the young people are struggling, students are struggling, faculty and staff are struggling, healthcare providers are struggling, even parenting is now a health hazard. So yeah, when we say people are struggling, we don't mean that everyone is clinically depressed or anxious. It's that most of us are in the yellow zone, the orange zone. We may have our fair share of daily stressors, moments when we feel sad or lonely, or your grant get rejected and you doubt yourself. Or when, well, maybe for some people, they just got diagnosed cancer and they are in a kind of feeling hopeless and confused. So that's, mental health is a continuum. And for us, we believe that the best place to intervene is when you are in the yellow zone, in your orange zone, you're on the verge of burnout, or you are coping with the daily stressors. So this is also a trend in the field that in the past, oftentimes we focus on a reactive approach to mental health, treating mental illness, but it's also oftentimes too little and too late. And now there has been a transition to a more proactive, more upstream, more public health approach to mental health. And here it's more scalable, it's more affordable. It also seems to make more sense because if you want to teach someone how to swim, you better teach them before they are drowning rather than when they are drowning. So that's why we believe that AI has a great potential here. And the good news is there has been so much knowledge out there about what you can do to improve your mood, to build deeper connection, to turn a day around, to overcome procrastination. And the bad news is we spend years publishing these papers. But the bad news is they don't reach people when people need it the most. This is the last mile problem science. So we find that AI can be a great solution to help people surface the most relevant knowledge and action at the right time. The moment when your grant got rejected and you feel just question your existence and your career choice, or the moment when you just got diagnosed with cancer and you need to know or your loved one get diagnosed and you need to figure out how you can go from here. So this is why we built the Flourish app. It's using AI and the science-based knowledge and approaches to improve personalized, proactive, and also social support to make this 24/7 continuous. And there are 5 core systems in the Flourish app. The first one is awareness. What need to know? What do you need to, emotion regulation. The second one is action. What action can you take? Even small actions, big impact. What action can you take to improve your well-being or build deeper connection? And the third one is habit building. How can you create a foundation, repeat the system, the routine that can improve well-being? The next one is social connection. How can you not just connect with AI, but connect with each other, your Flourish buddies, to support each other, to motivate each other? And finally, your personalized insights. How can we crystallize the learning, the journey, so it's after every conversation, after every week, after every month, you gain more deeper insights about yourself, about what makes you happy, what makes your life flourishing. So the product has been loved by people. It's actually rated 5.0 in the US App Store. People absolutely love it. But it's more important to us that we are scientists, so we want to make sure this is effective. So recently, we finished this RCT study with school partners. It's a pre-registered study. So with over 400 college students, so this is a wide range of students, from those who are perfectly happy to those who are depressed and lonely and sad. So the wide range of students across 3 different university campuses and college campuses, randomly assigned to either get access to Flourish or not. And for the Flourish condition, use it twice a week. Each time is just a few minutes. And after 6 weeks, so we track them well-being over 6 weeks and survey every 2 weeks. What we found on a very quick summary, positive affect improve over time for the students in the Flourish condition, whereas as the semester goes on, the positive affect decreases for the control condition. And for the belonging, so feeling a sense of a bigger community, belonging also increased over time, as feeling that you're more connected with the community. And mindfulness, it buffers students against the mindfulness decline over time. And for loneliness epidemic, many people have heard about it. It actually decreased loneliness more than the control condition. And positive mental health using the flourishing scale by Dr. Ed Diener, we also saw significant interaction here. So this upcoming fall, we are actually conducting a much bigger study with 13 campuses joining us. And what's also interesting is that, I should mention, we have also HIPAA compliance and advanced encryption and crisis protocol, not just to support students, but also beyond. So for example, right now we have reached over 200 schools, and what's interesting is also half of the use base are actually not students. So somehow the words get out, and we heard that BetterHelp therapists recommended Flourish to their patients or clients, and we have cancer survivors using Flourish, et cetera. So we are seeing more and more diverse use cases, and truly Flourish is the all-in-one well-being solution for behavior change and also for mental wellness support. So with that, I want to highlight our position on AI for mental health. It's not to replace therapists, but to help people in the moment to learn how to cope, to learn skills, and to learn how to better flourish. So with that, I want to thank you, and we are looking for partners and collaborators, and especially in the healthcare system. So thank you.
Thank you, Chen. I really enjoyed that last sentence you ended on. AI is not to replace humans, right? Because that's one of the most common questions, not just in medicine, but everywhere else. Everyone's asking, how is AI going to either augment or replace physicians? So I think that gives me a really nice introduction into our last speaker, Dr. Marcus Rojas, who's going to tell us what AI in medical education is going to look like. So Marcus Rojas is a physician from Santiago, Chile, and a PhD candidate at Stanford University's Graduate School of Education in Learning Science and Technology Design. His research explores the use of virtual reality, augmented reality, and AI in medical education. He is also the project director of Clinical Mind AI and research manager at the Chariot Lab of Stanford School of Medicine. Dr. Ross?
Hello, everyone. Can you hear me? Yes, yes. Okay. Well, thank you for having me here. I just want to tell you a project we're working here at Stanford University, and it all started with this, which is the most important skills that all physicians and health professionals should have, which is clinical reasoning. When you go to med school or any health professions, education, any program, we aim to teach you this mental skill where you're able to collect information from different sources to make decisions. That's clinical reasoning. And when we thought about clinical reasoning and all the challenges that it has, we started to talk to universities all across the globe, thinking when you try to teach a medical student or any health professionals clinical reasoning, what's the main problem you have? And the problem that most of all the universities mentioned was Most of the time, we teach with summaries. Summaries of information that are in a multiple choice question, in an open-ended question. It doesn't matter, you can find these summaries of information already collected by someone else in a very well-crafted summary with a very specific didactic goal. Then we ask you a question, what do you think is the diagnosis? But in real life, when you go to the doctor, you never arrive with this summary. Hello, doctor, I'm a male, 32 years old from Chile, etc., right? You go because you have a symptom, and you supposedly are in front of someone who is cognitive better than you at solving this problem, and you expect them to ask you the questions, to ask for the test, to summarize the information, and make the final decisions, right, about whatever is the plan to do with you. So when we started to think about this, we said, well, we're here at Stanford, so we have the opportunities of using new technologies. But when we went across campus in all these different places where you find people using technology for medicine, in most places we found one thing. We're trying to summarize information for the doctors, but not making doctors better, making more intelligent, cognitive better than they were before. It's not about using AI in our case to process the data for someone. It's about making that someone better in their mind, cognitively speaking. So we said, okay, we have an opportunity here to use this new technology, AI in this case, to make doctors better from the cognitive point of view. And that solution, we call it Clinical Mind AI. What is this project that it already started? We just started in August last year, so it's very new here at the university. Clinical Mind AI is a platform, it's an AI-powered learning platform that we designed specifically to teach clinical reasoning, to make clinical reasoning better in any type of health professions education program. And in this platform, we use AI for three things. The first and obvious one is to simulate patients. You can talk to the patient, you can collect the information from scratch, you can call them by phone, you can request tests, physical examination, as you would do with a real patient from the cognitive point of view, because this is on a screen. We're not aiming for you to touch the screen, we're aiming for you to think and say, what do I do now? Who do I call? What test should I request? What should I ask AI to process for me, etc. All the decisions you can imagine. But then we realized that we can use the same technology for other two tasks. Another one is provide real-time feedback. Now we can take all these interactions by the students, align them with the goals of that university or that program, and then tell you how the students are doing in these very specific learning goals. But also we found a third thing we can do with AI in this case, which is adapt the platform to how you teach. Why should Stanford University tell other universities what to measure or how to teach clinical reasoning when we already know that there are tens of different clinical reasoning models or frameworks? What if you input that into the platform and then we change the platform to be aligned to that framework? So we use a platform and all the technology to adapt to how you would teach and what is important for you. So we started to work on this last year, but we at the beginning thought, we already have these resources here. We already put all of this together. We want to give it for free, so we provide free access to all universities who request this here at Stanford University. We're already working with 14 universities across the globe in all continents, and this keeps on expanding every day. Just before coming here, I was in an onboarding with a new university from Chile, which is my home country in this case. And we keep on expanding and providing access to this platform to improve clinical reasoning everywhere. If you want to learn more, please visit our website, clinicalmindai.stanford.edu. Thank you.